Hey guys, it's board certified plastic surgeon Sean Doherty from Boston, and I just wanted to take the opportunity to talk to you about actually board certification and what that means. So a board certified plastic surgeon is someone who has training and accreditation that is approved by the American Board of Plastic Surgery. A plastic surgeon has gone to medical school. Then their first year of training out of medical school is typically an internship year. Then there's some component of general surgical training, whether that's 3 or 5 years. And then there's further plastic surgery training, which is between 2 and 3 years. And some plastic surgeons choose to then go on and do further training in aesthetics or microvascular surgery or hand surgery, etc. So in general, a plastic surgeon has trained for 4 years of medical school and between 7 to 9 years of training afterwards before starting his or her practice. And what's specific about a board certified plastic surgeon is that, again, they're approved by the American Board of Plastic Surgery. So that board has a fairly rigorous training program, and we have to meet several standards to actually get that board certification. Number one, it's going through training. Number two, it's passing a written exam and then passing a fairly strict oral exam that's based on actually 1 or 2 years of actually working and treating patients as well. It's fairly complicated and intense, and I'm happy to have already gone through it and not to have to go through it again, and I'm very proud to be a board certified plastic surgeon. What's specific, again, about the American Board of Plastic Surgery is that it is approved by the American Board of Medical Specialties. That's the ABMS, and that's sort of the standard of board certification of medical training and specialties in this country really since the 1930s. And so a plastic surgeon, an orthopedic surgeon, a dermatologist, a radiologist would have their training approved by the American Board of Medical Specialties that approves their training. So what sort of further complicates things is if you go to a facility and have a board certified doctor perform injections, say a Botox injection or a facial injection with fillers, you really need to ask them what is their training, what type of board certified physician are they, because technically a board certified emergency room physician, a board certified pediatrician, or an internal medicine doctor could be performing aesthetics, and that is completely appropriate. That is actually within the scope of practice of physicians to be doing that, and that really is dependent on state by state, but it's appropriate. But patients do need to know what type of board certified physician is treating them. As a board certified plastic surgeon, I feel that all that training that we've gone through has really prepared us to understand specific anatomy, and be able to handle problems and perhaps not allow those problems to happen, or ultimately be able to take care of those problems if those occur in all things aesthetics. I'm not saying that plastic surgeons are the only people that know how to do anything like that, but we're specifically trained for that. So I urge every patient to ask for a board certified physician and then really to find out what board certification there is. And just a shout out to my colleagues aesthetics, which I've chosen to do in plastic surgery. We have a core group of physicians that really treat aesthetics, and those are plastic surgeons, dermatologists, ear, nose, and throat physicians, also known as ENTs, and then facial plastics. I really feel that, in addition to that is oculoplastics, so physicians who work on the eye. That group of physicians really has a similar training, and you should feel very comfortable in having aesthetic procedures by any of those in that core group of people. Again, if you choose to go to a facility where an internal medicine doctor or a radiologist is performing a procedure, I just say ask questions about what people's experience is, how they're going to handle problems, and how do you get in touch with them if there's a problem after hours. I think those are really important things to ask any physician. I do, lastly, as a board certified plastic surgeon, love when people come to board certified plastic surgeons for their work. I think that we treat the face, the body, the breast, extremities, hand, and some of us have chosen to do more of some of those procedures than others, but I do think a plastic surgeon is one of the best people to go to. So I hope that clarifies things and didn't cause too many questions or confusion, but feel free to reach out to me if you have any further questions, and let's all keep aesthetics safe and fun. Thanks.